Hey, everybody, welcome back to Therapist Uncensored. This is the second of a two-part series, and we are picking up where we left off last time. This episode can stand alone, but if you're picking up here, there's a episode before that where Gliceria and Debra walk us through some of their journey. And we're picking up on a special group and again, I'm here with Debra Chatman-Finley and Gliceria Perez. And we're picking up with a particular group that was very influential for you.
Yes, thank you. Yeah, especially when we were talking about this journey that both Gliceria and I have been on and continue, you know, this particular women of color, and I guess we can call it a support group that we did, was perhaps for us one of the biggest, the largest, the greatest influence for me about race, how it shows up in families, how it shows up in parenting, and trauma. That, oh my gosh, there's the trauma that these women had in their history, but there wasn't a meeting where race didn't come up. So it was a group that we did, and most of the women in the group I saw them individually, and one of them had asked, could we do a group, some kind of group? And it's like, okay, we'll do it, but I didn't want to do it alone, and so I asked Gliceria and if she would join me in doing this group, and it was we thought we were going to have set hours. But let me just say, first of all, we realized that we did not do the group in a Eurocentric way at all, at all. First, I think having an African American woman and a Latina, and all the women in the group were Black. They were all professional, pretty much professional women, educated women, and it was an interesting dynamic for Gliceria, and I wanted Gliceria because Gliceria had been doing so much work with children, and I was working with the mothers, and it would be great for them to hear from Gliceria, from the child's perspective, because some of the things that they wanted to talk about was their romantic life, work life, and their life with their children. And so the group, the first time we met, we were going to do the typical 2-hour. We never really said that, but we were going to do it. And I think we had coffee and cookies.
Yeah, donuts or something. Yeah,
donuts or something like that. And they came in and they chatted, but it wasn't comfortable, I don't think, for any of us. And then I think it was like one of the women, because of the time, it started at 6:30, something like that. They were hungry.
Exactly.
So we thought, well,
and
maybe
they would
we
say,
can add, and they would say, yes.
They would say it. Can we order pizza, or can we do this?
Yes.
So yeah, that's why we started to get the idea of bringing in food. And so she and I started to bring in food. And
I'd
then
make a salad.
Right.
And then the women started bringing in food. And if anybody saw my office, when I talk about we had a spread, we had a spread. And the interesting thing about the food was the more food, the more they shared.
Exactly.
And it was realizing this can't feel like therapy. This cannot feel like therapy. Exactly. This has to feel like a group of women, sisters.
Just getting together.
Getting together.
Yeah. And even Oh, sorry, Deborah. Even the food that everybody brought in meant something.
I
So
was
that's
just
kind of like
thinking
how
that
it
the
started,
culture of,
you know? Yeah, but that's how it
Yes.
started. Deborah would bring,
Yes.
salad and I would bring something else and, but they would say, "Oh, I'm bringing this. Oh my God, you guys have to try this or this Chinese food or this or, whatever it was." And
Yes.
that started the conversation and we saw that it got richer as the food did.
Yes.
And so but it was just like Deborah was talking about it, how this was a great experience for her. I thought it was the greatest experience for me professionally because it helped me move my thought process when it came to parents, and like Deborah was saying, I was the only Latina in the room. And so, it was like I felt like, oh wow, what can I contribute? But it was like when I started to talk to them about children and how they view certain things and kind of like establish and engage in conversation about what I saw, what I found, and then my own personal experiences as a child, bringing that stuff up too. So it was like a little bit of everything to gain their trust, you
yeah.
know?
And so can you just sort of, so were they paying for this group? This is
Through their insurance.
through their insurance. Okay.
Yes.
And then are you
Yes.
sitting in a circle? Where's the table? Is it in the middle? Or are you sitting around it? Like, just what does it look like?
It looked like a
Well,
living room.
it looked like a
We're
living
just
room
sitting
because
around.
yeah,
We had
yeah,
couches and two
yeah. I
chairs
had a
and
pretty big back then. I
yeah.
had a pretty large office where this was
Hmm.
located, and so yeah, I had a long coffee table, and we added to that coffee table to make it look
For
like
the
almost a
spread.
long dining room table for the spread exactly. And like I said, the more food there were a couple of things that began to shift in that group.
Hmm.
Um, One was the amount of food, and I'm sure all the other therapists, all the smells that were, everywhere, but also um, how much they needed to know. Even though I was their therapist that they saw one on one,
Mm,
and then it was Gliceria. Okay, it was like this is a different setting here. Who are you?
exactly.
It became who are you? So sometimes it meant some of the activities that we may have asked of them. Okay, we did it too. We
Hmm.
might share.
Hmm.
Um, and the question of sharing uh, wasn't quite um, traditional because we did share. We didn't make it about us. We didn't disclose too much. But how much you disclose, how much you would share with them became very important to them. Who
Hmm.
are you? They
Hmm.
respected us. They knew we were the therapists, but we were sort of like, I call it the aunties. And in Black communities, it's like that's the person you can go to. You can
Yeah.
talk
Yeah.
about stuff, right?
Yeah.
And so there was the respect there. So it was the sharing. It was the hug. We, you're not supposed to, but there was no way that we can say to these women, no, no, sorry, you can't hug me because,
Exactly.
um,
After they
you
just
know,
poured out their heart, after they
yeah,
just shared so
yeah,
many intimate
and that,
and difficult historical things that occurred to them as children, and then how they were parenting their children. I mean, you can't get to that deep level and not greet them or depart without a hug or see you
yes,
next week, and just that comforting feeling
yes,
for them, that they were heard, they were seen, they were understood, and they were challenged,
and
so
they were
but it was
challenged.
but in a safe environment, that we really worked very hard to create, you know um
Yeah.
where they
Yeah.
were
And
free to come in and talk about whatever they wanted.
so
And
time
they
boundaries, I'm sorry, go ahead.
got no time boundaries. That's a
Time
good one.
Well,
boundaries was
that's a
one,
good one.
where
Yes.
that you needed to
X-nay.
X-nay, X-nay on the time boundary.
Hmm.
And then the food, the hugging, these are all, and then the self-disclosure is interesting too around, it sounds like part of what needed to happen is is a anti-hierarchy, kind of like
Hmm.
that, because you
Yes.
mentioned the
Yes.
word
A
respect.
leveling. Hmm.
That's right.
Yes.
And it doesn't
Yes.
make you not the therapist.
Right. Right.
That and that I think that was so important. And
Hmm.
I it wasn't I don't think Cecilia and I realized that we did that
Right.
until stepping back and really looking at it,
Exactly.
because there was never a time that we could say, no matter what happened in that group, that we weren't respected as the therapists.
Exactly.
But it wasn't as if we were the therapists.
Exactly.
It's a
You
very
know,
difficult thing to
right.
get it to
And
explain. But
we also had to co-sign some of their experiences, you know, that this, it happened, that this, you know, it didn't just happen to you, it also happened to me. Like, we, certain things that we were exposed to, certain things, the way people made us feel in certain places and spaces, you know. So it wasn't just, you know, oh, let me just spew out all of this stuff. No, it was more about identifying, oh yeah, you know, this person needs right now to be
right,
supported, and I
right.
have a similar experience, and it's okay to share that. So
We spent a
yeah.
lot of time validating, and again,
Ah,
I'm going to bring up something that learning from Ken Hardy. He calls it VCR: validate, then you challenge, and then you make your request.
hmm.
People need to be validated, because if I can validate you, it doesn't mean I have to agree with what you're saying. But if I
Exactly.
can validate you, it says, okay, you got it.
Exactly.
You understand. You hear me.
Exactly.
And so they began to open up about a
Right.
lot of their traumas. And it was like, okay, I knew a little bit. We knew some surface stuff, but that was where I wanted to learn more. Go ahead. I'm sorry.
Exactly. No, I just wanted to add to the validation. And one of the things about validation is, like, you validate until that person feels validated, not until you feel
Yeah.
that that
Yes.
person, until they are
Yes.
giving you
Yes.
some kind of sign, some kind of signal that they're co-signing
That,
with that, you know, that
yes.
they, that, yeah, absolutely.
Yes.
And then you
Yes.
can proceed. You can't
Yes.
push it. They
Yes.
really have to feel the validation, you know? And
And
so then,
probably, I'm sorry.
no, I was going to say, you can't
We
proceed with the challenge or anything else.
we
Yeah.
get so excited. Sorry.
I
Oh,
know.
totally.
We
Yeah.
I'm
talk over each other.
wrapped.
And probably the most difficult time in validating was when we had anger and rage in the room.
Say more
That
about that.
was, yes, that was
Yes. Yes.
perhaps the most difficult time to make space for
Hmm.
the anger and the rage that would come up in the room because of their experience, or sometimes colorism
Hmm.
brought up anger because, we had some women of a darker hue and we had some, women of a lighter hue, and that stuff was in the room.
In the room.
And
Right.
so
Yeah.
that we
And
had to
hair.
make, and hair, all of that was in the room, and to make
Hmm.
space for that anger and
Hmm.
help them to understand that's really hurt, that's
Hmm.
really your pain,
Hmm.
that's been your protector.
Hmm.
um but yeah, to validate that. And while I may not, or Syria may not have agreed with what they were saying or how they were saying it, of course we wish you could put it in a different way. But that's what you needed. That's
Hmm.
what you needed. You needed a space
Hmm.
to be able to say,
Hmm.
um, I'm fucking tired of this. You
Yeah.
needed a space to say
Yeah.
it and
Right.
be okay and not be
Hmm.
judged and
Hmm.
still be held. And
Exactly.
that was, so I think those were some of the more difficult times
I bet. I
with
mean,
Absolutely.
how
validating.
could, in a safe setting like that, like it sounds like you found yourselves so that you were expressing
Hmm.
yourselves, and then you heard them and you met them, but you
Hmm.
maintained it as enough of a frame that then the deepening could happen. And if that
Hmm.
Exactly.
deepening's going to happen, if it sounds, you really would, of course there would be. I mean, how could there not be this
Hmm.
aggression and rage?
Hmm.
So that totally makes sense. So I'm also thinking about like, you've learned so much from that, and what mistakes do white therapists first of all, I love expanding our frame of like what's good therapy. It's not just what we've learned in school.
Yeah.
Right.
We learned a European white, from white scholars typically. So we're not aware of it, just like you weren't aware of internalizing when we were talking
Right.
about them
Mm-hmm.
making you white, and then you
Mm-hmm.
have to like come back to yourself.
Exactly.
So
Mm-hmm.
we're not aware of it. But what are other things, like, because one of the things you had mentioned before was that they also spoke to you about what it was like to see white therapists and the
Yes.
difference. And
Hmm.
so,
Yes.
yeah, translate that for us around what we can learn.
The persona that they would bring
Yes.
to the white therapy room, they would not be able to. They didn't feel comfortable presenting certain things, certain subjects. So when it came to race, they didn't discuss it. When it came to things that happened to them in their history, they may or may not, depending on what the circumstances were. Because they were afraid of being judged, or if somebody disciplined their children a certain way, they were afraid that institutions were going to be
CPS.
called in.
Mm-hmm.
Yeah. So there was all of this stuff. There's like this part of them that needed to protect themselves, wanted therapy, but needed to protect themselves. I was telling Deborah that just about a few weeks ago, I had like two back-to-back clients, two back-to-back people call me that they wanted therapy. And they said, first of all, I saw in your profile that you're Latina. And I'm like, yeah, I'm Latina. And do you sit there in therapy and just listen, or do you actually talk?
Mm-hmm.
I was like, wait, what are you talking about? Oh, and then they start telling you the stories about the stuff that happens, or the other stuff that happens is like when they do finally feel comfortable and are saying something, then the question that comes back to them is, well, are you sure that that's what they meant? Are you sure that that happened? So again, questioning them, and so these are the kinds of things that happen. And those are the kinds of things that we heard all the time from these clients in the group as well as outside of the group. Yeah.
And I agree with you wholeheartedly. And I would just add that these women, and I would say it's true for most people of color, are very much aware of the stereotypes about who they are.
Absolutely.
Okay? And so there were a number of times where they did not disclose about a sexual assault and maybe their sexual activity afterwards because they're aware of, for example, with Black women or Latinas, how
On
they're
Latinas,
viewed.
yeah.
So that was one thing. And the other, I think, was being authentic. Being authentic. One of my pet peeves, sorry, but one of my pet peeves is when we presented and people wanted, what do I do first? What do I do
step
second?
by steps.
That
Yeah.
it doesn't work that way because I think as people of color, we have to always look for a safe place all the time. Is this person safe? Am I going to experience racism? Am I going to experience racial microaggression? What am I going to experience from this person? And just because you're the therapist doesn't mean that those thoughts don't go away, right? And I think it's about being authentic, being attuned, but the authenticity. Because you can make a mistake. I've made mistakes. I've had to repair relationships and still do. Because, oh my gosh, I didn't realize that I had some biases with certain women when they did certain things. Oh, that's coming up. Oh, it's not her job to repair it. It's my job to take ownership of how I screwed up, how this stuff was here for me, and how it came into the therapeutic relationship. But it's being authentic. You can make mistakes. We're human. We are not always going to say the right things, but people know when you're not being authentic. It comes through. You may say all the correct questions. You may ask all the correct questions, I should say. But people know when that's an authentic question and when it isn't.
And that's part of why that you resist the list is you don't want techniques. It's more, and there was something else in a conversation that we had previously that I think was really important also about driving this home was you talked about your reaction to some of the women's parenting and that you had a perspective on that. And so this brings in trauma. And
yes,
would you mind sharing that?
Do you want to?
I don't know where to start.
That's a tough one because that was a big issue.
That was where we saw the anger and we saw a lot of rage because there was a lot of stuff coming from the generation above, like their own parents, and how they were treated and their childhood experiences. And then you have those wounds and then you're becoming an adult still with those wounds and then you're parenting the next generation. So there was these expectations of children, and all of these other things that they were carrying. So, like I remember this one woman, because it just broke my heart that she came in one session and she was really upset with her daughter. And she was upset with her daughter because the daughter had been standing on a toilet seat. And we're like, okay, why would she be standing on the toilet seat? Oh, because she wanted to look in the mirror. Why would she look in the mirror, like on the toilet seat? Like, because it was the only mirror that they had in the home. This woman had her issues with her own race, had a lot
Her
of stuff
skin
going on.
color.
Her skin color wouldn't let the daughter go outside because she didn't want her to get too dark. They didn't want to have mirrors for certain reasons that she shared. And so, so to me, it was like, wow, this little girl, what messages was she getting about herself, about her appearance, about her skin color, about who she was, And so there was like moments like that were really touching. And Deborah, I know you wanted to say something about that.
And just if we just stay with that person and that
Yeah,
example. So here we have the colorism issue there,
right.
right? But this was also a person that was going through some questioning about her ability in a white workplace.
Mm-hmm.
And so, they didn't always leave that at at, at work.
Exactly.
And a lot of
Exactly.
times most of the women worked in white space, they were in white spaces, and feeling invisible, feeling not heard, feeling
Used,
disrespected,
abused. Mm-hmm.
not that, not of value. And what we began to realize, it's like, okay, I was ignored there. No one's listening to me over here in that place. And it was sort of like, well, I'll be damned if I'm going to come home and you are not going to listen to me. So
Exactly.
they were carrying all of that
Mm-hmm.
into the home and
In
with their
addition
kids,
to
in
their
addition
history,
to, in addition to
childhood.
their own trauma history, right?
Exactly.
And so the parenting, I could see how other people would pathologize these women, and we didn't want to pathologize them. It's like, because talk about women who love their children, would do
Yeah.
anything for them.
Anything. Mm-hmm.
But if you heard sometimes the way that they would talk and what would happen, you would think otherwise. And it was part of in the group was talking about what it means to be in these white spaces, how it does make you begin to question
Mm-hmm.
you, and it's not you, and you're carrying. I always used to love to share with them one of my favorite quotes by from Maya Angelou. She used to say, "Don't go through life carrying two catcher's mitts. One, because you're carrying everybody else's stuff. It doesn't
Mm-hmm.
belong to you." And
Mm-hmm.
and so and helping them understand and making a safe place where they could talk about racism,
Mm-hmm.
and if they wanted, they
To
needed to
unpack
talk
all
about it.
that. Right.
But we need to help them to see, okay, but when you're bringing it home and your child doesn't quite understand that you just had a white coworker
Mm-hmm.
take credit for something you did,
Right. Right.
your child doesn't understand that.
Yeah.
So
Yeah.
so it was a lot of that, and I have to say, race came up all the time. And in
All
the
the time.
beginning, I'll just say this real quick. They used to apologize, like, I'm sorry, but I have to say this. I'm sorry, but I have to say this. And we'd say, you don't have to apologize.
Right.
It's your experience.
Right.
It's okay.
Absolutely.
It's okay.
Absolutely.
Um, and
Yeah.
and I'll just add this one other piece about the group that we saw and knowing more about their trauma outside of the racial piece. Um, and what I saw in working with them individually, and both Gliceria and I felt we needed more training about
Absolutely.
trauma. And that's when we started going to the Trauma Institute in Boston with Bessel's place. Um, and for me, I saw the way that these women would dissociate was different, because the dissociation was with an attitude. And
Mm-hmm.
I would think, oh, she's got an attitude. And what
Mm-hmm.
was really happening was she left.
She
But
left.
that attitude
Yeah.
face, they would call it their resting bitch face, was there
Yeah.
because that was a protector.
A
It was sort of
mask.
like that. Yes,
Mm-hmm.
yes.
Mm-hmm.
And it's like, oh, okay, that's what
Yeah.
that's about. All right,
And
that's
making
your
space
protection.
for that part to be able to vocalize what
Yeah,
was going on, what
what
it
was going
felt.
on?
Yeah.
Yeah,
Yeah.
yeah,
That is
yeah.
so important. Everything y'all are saying is so important. But these little things like that, like it would be
Yeah.
so easy to misinterpret. And I totally
Exactly.
agree about, the what lens you're looking at related to the aggression towards the kids,
Exactly.
Yes.
and being able to pull the lens back and
Mm-hmm.
really see, and also the adaptiveness
Right.
of so that if the kids kind of then get their own armor, it's going to
Yes.
help them. But we
Mm-hmm.
would historically call that an insecure attachment, like the
Yes.
term insecure, when
Mm-hmm.
actually it's an adaptive strategy,
Mm-hmm.
and it works, and it's
Mm-hmm.
effective, and that's why.
Mm-hmm.
So
Mm-hmm.
we need to watch ourselves from then looking at it from this other lens and pathologizing it versus
Exactly.
Exactly.
seeing the strength
Yes.
and seeing the how it makes sense.
Right. But also
And
staying present with them,
same present.
staying
Yeah.
present with them and holding them
Yeah.
as they share these incredible, painful situations, and helping them kind of navigate,
Mm-hmm.
past that, and recognizing, helping them recognize that they were now in the present and they could affect change with their children, in the next generation. So it was an incredible, time. And I remember instances where they just brought me to tears because it was just so much. And having heard the parent perspective working with children was enormous. It was a tremendous gift for me because then I was able to help the children kind of figure the stuff out
Right.
for the parent and how hard it was for
Right.
the parent. Without them, I wouldn't have been able to help that 14-year-old
Right.
boy that I talked about earlier, letting him understand what happened to
Right.
mom, what was her
Yeah.
story, and then talking to mom and helping her understand what his story was, because
Right.
that's where the repair needed to happen. The repair needed to happen in them knowing what they went through. And so when they shared in the family session, it was incredible. It was incredible what happened. Mom was able to, with a lot of therapy, was able to hold the child and apologize for certain things, and the kid was also able to apologize for some of the stuff and also explain to her, those years that she wasn't present. But the whole time she kept holding on to, but I was there, I was there, I was there. I called you every day. I called you every day. And she did. She called him every single day for those years. But being present in person was different than on the phone. So she eventually got that.
I think like one of the things, maybe a couple of things, it's like, and it also helped me understand some things about my own mother,
Right.
and my own family and
Mm-hmm.
women and my family, that they had their own family stories, their own traumas, but they were also women of color. And so they all had to deal with what does that mean? And all of
Mm-hmm.
these outside factors that
Mm-hmm.
affect how their sense of self, right?
Mm-hmm.
And so it became so important that they had to have some place where they felt valued.
Mm-hmm.
And
And
I can
heard.
think and heard, but that where I'm valued, and I it's not out there, you
Excuse me.
know, but maybe I need it in here
Mm-hmm.
in my home, and it was such, and I thought about, wow, that was such a trigger for my mom. That was such a trigger for so many people, parents of
Mm-hmm.
color, and they would call it respect. That's a word that you can do an entire
Mm-hmm.
dissertation. What does that mean
Mm-hmm.
to
Yeah.
people? Because I've seen people behave in ways that you would never think that they would when they feel disrespected.
Mm-hmm.
And that was always the reason that these women would give. They felt disrespected by their
Mm-hmm.
child. It wasn't the child that disrespected you. It was
Mm-hmm.
the people on
Outside.
your job.
Mm-hmm.
But you couldn't have a voice there.
Mm-hmm.
You had to submit there. So
Yeah.
that was your trauma, because those were the microaggressions that were happening at work. So that was the other thing
Daily.
that Gliceria and I looked at. What trauma responses were happening to people at
At
work?
work. Mm-hmm.
And so the fighter part of you wasn't going to show up at work,
Mm-hmm.
but it
Because you needed that
certainly,
job. You
You
needed
need
that
that
job.
job.
Yeah. Right.
But
And
that
you would be
fighter
given
part,
no leeway.
No,
Nobody would
absolutely.
understand. Right.
Nobody.
exactly,
Right. Right.
exactly. Um,
Absolutely.
but
Yeah.
sometimes that fighter part showed up at home.
At home.
And then this was the other thing about the women in the group. Um, Black women learn very early on about being strong.
Mm.
And there's a movie, I didn't like the movie, The Help,
Mm-hmm.
but there's a scene that I always remember, two scenes. And there's one where Viola Davis's character is talking to the little white blonde haired girl, and she's going, "You're kind, you're beautiful, you're all of that," right? And then there's another scene where I think her name is Octavia Spencer. The other name is talking to her daughter,
Mm.
and she's talking about strong and things going to be tough and you got to be ready. And I'm like, yeah, that's the stuff that we all grew up with, and
Mm-hmm.
so did the women in that group.
Mm-hmm.
And so when they would cry,
Mm.
not just about the times when there was anger and rage, but when they would cry, we
Yeah.
had to make space, let it
Absolutely.
out.
Mm-hmm.
It's okay. You're
Yeah.
still strong
Yeah.
to cry, to
And,
just cry.
and as we got,
Um,
towards, as they got more used to us and everything else, they would just, we would, because one of the things that we would do is do a check-in, and so then it would be like, oh, so we would, hey, so and so, how are you doing? How was your week? It was like, I'm good. And so then it was like the tissue box would be passed to that person, because then it's like, yeah, no, we know, no,
that you're
and then
not good.
yeah, you're not good. You're
Yeah,
saying that, and you're
yeah,
not. And then they
yeah.
we then they started to imitate us, like what Deborah would say, what I would say, so that they would like helping each other in that way. And it was just really, really a very good experience, and it was amazing. And um, they years later, we're still in touch with them, and they talked about the impact and how, it
Mm-hmm.
helped them to see and to become better parents
Mm-hmm.
and present, and be present, the adult part of them to be present with their children,
With your children.
because it was just so hard for them, and they didn't even realize all of the stuff that was happening to them, but they recognize, like their growth. They recognize, and they also recognize each other's growth,
Yeah.
too.
And
Life
I and
changing. Go
yeah, and I would just add that the more we understood and learned about trauma
Oh,
and
absolutely.
parts,
Hmm.
that's we were able to share and integrate that in our work with these women,
Hmm.
um, and help them to even understand that that angry part, that's a part.
Hmm.
That's just a part of you. It's a
Yeah,
protector,
yeah,
and it made a difference.
yeah.
And we're very happy to say that the children of those women have
Oh,
done extremely well.
I was
Have done
actually,
extremely
I was
well.
just thinking about like the 7 generations beyond. You know what I mean?
Hmm.
And the kind of impact that the two of you are having and that group had on one another is remarkable. Are there other, then you went to the Vessels, Vanderkolk's training.
hmm.
And what about racism there? And
Do you have more time? Do we have time?
well, we have to talk about it, and because it's continuing to be perpetrated, and then also the concepts, the trauma concepts, going back to like race as trauma, racial trauma, the
Yes,
systems.
yes.
Right, right.
I think, well, first of all, our trip to Boston
And
every
from.
week for 9 months was talk about trauma. That was a traumatic experience, and a lot of it was racial microaggressions. Um, um,
Could you give
so
us a
that
couple of examples so that when you say it was trauma?
I think the first one, and I think this is an example of the differences. We are both
Yeah,
women of color, but the differences in my being black and Gliceria being a Latina. You want to tell about on the train?
on the train. Yeah. So
The first one, the
the
men.
first the first ride that we took, I was pulling my little luggage piece, and I noticed, that people weren't moving, and I didn't know why, and I was getting really annoyed and whatever. And so, so I said something to Deborah, and she was like, oh yeah, nobody's gonna move for you. And I was like, wait, why not? You know, I'm coming in with the thing. And she's like, yeah, nobody's going to move for you. So the second time that we went on the train, the same thing happened. And she says, watch, nobody's going to move for you again. And I was like, what are you talking about? Like, and I couldn't believe that nobody moved for me to be able to navigate, you know, like the aisle there on the train.
So
And she
you
says,
had to go around
I
them. They
have to go
wouldn't
Yes,
they
around
we
wouldn't
had to
them.
cede
move over.
space.
Yes,
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 yes.
yes. So then she's like, yeah. She's like, we move differently. You know, white people take up space, and it's okay for them to do that, and we have to accommodate them, but they won't accommodate us. I'm like, what are you talking about? And it was my mind just blew up because it was like it never occurred to me, and it may have happened to me in the past, but I never saw it. I never thought about it. Never, and until that moment, and then I did it on purpose, and I was like, oh my God, you know. And then I took up space to see,
And
and
then
it
you're going
was
to be
like,
perceived as aggressive.
oh,
Yes,
exactly,
yes,
exactly, yeah,
yes,
yeah. And the
yes.
other, there were so many. Every week there was a different incident, and one week we were in the car where everybody on that particular part of the train had their computers out, and Deborah and I were working and we're talking and we're laughing and whatever, and we were creating a workshop, and so we were back and forth. Excuse me. And like two stops before ours, a man came over and he was getting out, and he came over and he's like, you know, I see the two of you working here and having a really good time. What are you people working on? Okay, everybody else was working. He didn't go to anybody, but he came to us because, of course, we were the only people of color on the train. And I was floored again. I was floored again. Like, how dare you ask me? Like, it's not like he went around, you know. No, it was just us.
He insisted
He
that we tell
insisted.
him what we were working on, and we were
He
like
kept saying, I'm
insisting that
serious.
we're not telling you anything. No, we've that that experience in Boston also is a great program. We learned a
Yeah,
lot. It
yeah.
was a lot.
They were really excellent.
But if there was anything that I wish there could have been more of, was
Mm-hmm.
the integrating about race throughout the program. And when there was anything about trauma for, with a marginalized group, it was more so about, the Holocaust, which was traumatic, not taking
Right.
anything away from, but
And the
okay.
veterans.
And yeah, he talked about the veterans, but I just
Nothing
wish
of,
that there was more
yeah.
about, you know,
Immigration. Yeah.
immigration, you
Slavery.
know,
Hmm.
yeah, that those were those are
Highly.
historical and intergenerational
Absolutely.
trauma,
That we're
and
still experiencing.
that we're still experiencing. And for me, Joy DeGrye's book, Post Traumatic Slave Syndrome, helped me so
Hmm.
much in understanding all the parenting
Yeah.
styles.
Hmm.
It's rooted in protection. So much
Absolutely.
of this, so much about our culture, and I think so many cultures, has to do with
Hmm.
oppression and colonization and those
Hmm.
things, and they're about survival. And I thought about even those women. Yeah, there were times it could have looked harsh, but they're trying to protect. They're trying to
Hmm.
prepare
And
their
educate.
kids for,
Hmm.
this is what the world is like.
Yeah.
This is what the
Absolutely.
world is like. And in
Because they're
fact,
not
one
going
time they came at me. Remember, she was like,
to.
no, I'm not gonna, because what do you want me to do, Deborah? I remember her saying, want me to teach my boy to act like a little white boy? No, that's what she said to me, and I'm like, oh, let me stop. Let me think
Hmm.
about this, because
Hmm.
he's a black child,
Hmm.
and his life is going to be different when he walks out there. It is going to be different when
Hmm.
he's a teenager versus, that. So we had to
Yeah.
check ourselves, because there were times when the women
Exactly.
triggered. I got
Yeah.
triggered,
Hmm.
and being in touch with what was happening with me. But
Well,
yeah, it was,
yeah. And I noticed that you said, whoa, we have to stop. Like, in other words, you took that. You didn't
Hmm.
push back and say, no, that's
No.
not what I meant. You
Yeah.
you were like, oh,
no,
you're
Step with
telling me
it.
something. So
Hmm.
yeah,
that's good modeling,
yeah,
right, for
Hmm.
yes,
when that happens.
yes,
And then
Yeah.
I'm also thinking about something that we often miss as we're looking and we're working really hard to expand, how we see attachment and human development. And, we talk about like this cultural context umbrella. And part of that umbrella is some of the stuff that y'all are both talking about protection and these cultural strengths that,
Absolutely.
you know what I mean? That we might miss, but that needs to be incorporated in how we're seeing someone, whether that means that there was a cultural strength that ends up backfiring for them, or just plain old pride and culture and stuff like that. That is part of human development. And so really incorporating those kinds of things so that we're seeing a full picture of
Absolutely.
someone rather than just,
Absolutely.
Yeah,
And
be more curious about what their thought process is. That piece about the kid needing to respect you, because when I say no, it's no, because it's dangerous. If I'm telling you, don't go here, don't do this, it's because it's dangerous, and you need to listen, and so it's a lot of that, like Deborah was saying, protecting their child, because they can't be with their child 24/7. So
yeah.
it's helping them do that. Yeah.
And Gliceria, I'm wondering, Deborah's example of Black dissociation and us, the lens on that. Have you noticed anything related to that in the Latina community? Is there a parallel?
There, other than like, changing language, because I think that sometimes happens, it's like, like when they start talking about like their younger selves, or when they start talking about their grandmothers or any of their ancestors, like, there's a shift, and also in the Latino culture, there's a lot of spiritualism too. So you're going to
Yes.
get a lot of
Yes.
different things that
Yes.
happen in terms of, whether they, how they practice certain religions and what happens,
Mm-hmm.
and
Mm-hmm.
disassociating that
Mm-hmm.
way, or just,
Mm-hmm.
just not being present, or just the whole thing
Mm-hmm.
about culture and, how women are supposed to be, how men are supposed to be, and just all of these different things that they're navigating. So
Mm-hmm.
yeah, so sometimes well, at least for me, what I've seen is, because I've seen a lot of more bilingual women who have been born and raised here, or so. But when I see the immigrant families, there's a lot of other stuff that happens, for them. Yeah, like
Yeah,
there's a
and
shutdown. There's a
Yeah.
yeah.
Can I just like one of the things so that I think I've always somewhat struggled with when it comes to the attachment theories and stuff like that. It's like um I don't know, or maybe there are, but I think it's usually about like as if there was only one caregiver, maybe two,
Mm,
and we may have multiple. There
exactly.
probably are multiple caregivers in the home, you know,
Sharing the roof.
and yeah, and it's like so how does and I could see how that could become pathologized because each one may have a little bit different little twist little things that they may do that's different, but they all are looking out and trying to do what's best for that child, and and there is a message that we get. Yes, like some people will get the message. You can be anything you want to be, but somehow in there's a little bit of a but it's all so don't forget who you are kind of thing.
Mm-hmm.
Um, but this whole piece about caregivers and our resources, and you can't talk about attachment and connecting without including ancestors,
Oh,
the
absolutely.
people who were
Yeah,
are before us. We don't think just in terms of who's here,
exactly.
and you have to be open
Yeah.
to that, and maybe that's part of what we were talking about in the first segment, deconstructing that, letting
Mm-hmm.
that go, and be open to, okay, maybe that's not what I do, but for people who don't look like me, now I was talking
Mm-hmm.
about this for a white therapist, that part about the ancestors is real
Mm-hmm.
important. For
Mm-hmm.
me, I get a lot about, well, what church you go to, and like, okay,
Mm-hmm.
I'm not really part of a church. I grew up in a church, and I had to figure out how do I answer that, and
Yeah,
not throw it back at them with a question. Well, what
exactly.
does that question mean to you? No, they don't want to hear that nonsense.
No,
It's like I had to think about, because I
exactly.
said, I'm in search, and I missed
Exactly.
part. I grew up in the church. I miss some aspects of the church, but I'm going through my own journey, my own search.
Authenticity.
Oh, okay. Yes,
Authenticity.
Yeah.
yes,
Yeah.
yes,
Yeah.
yeah.
Absolutely.
And you're not
And the
interpreting
pressures.
the question as a
No,
resistance or something like that. It is like, okay, this
no,
is a bid for
Yeah.
no.
connection.
It's a bid for
Absolutely.
connection. That's what I meant about wanting in our own way. Who are you? I know
Hmm.
you're the therapist, but who are you?
Exactly. But
And that's going to let me know if I can trust you. If this is
exactly.
a safe
Absolutely.
place.
And the other thing
Yeah.
too, for people of color, or Latinas in particular, Latinos, next, is the piece about balancing the cultures. That piece about, balancing the culture and who you are in front of your parents and who you are, in the community, and who, like, just balancing who they are, and what's going on with them. They may respond a certain way in front of their family as to
Right.
certain things, but then there's this other piece that their family may not even know about them, and
Right.
then so there's all of these, like
Right.
cultural expectations and pressures too. So yeah,
Multiple identities, right?
exactly,
Absolutely.
And I'm
exactly.
just a few hours from the border where that kids are being detained and separated. It
Wow,
is
heartbreaking.
so. I mean, trauma
Yeah.
on top of trauma on top of trauma,
I
right?
can't
Yeah.
Yeah.
can't even
You know,
imagine.
if I could just add one more thing about the trauma
You can
and
order 10,
race,
you can add 10 more things.
um, because it's something that I'm also very proud that, well, a couple of things that Gliceria and I are working on, but it's about this wounded parenting and race and but we're big fans of Janina Fisher
Oh,
and have done some work with Janina and love her parts work.
hmm.
And Janina had this chart about how trauma shows up as symptoms, right? And I was very proud of how we took that chart and we thought about, yes, but so does racial trauma show up as symptoms as
Hmm.
well, and added to that, like the fear of being weak,
Hmm.
um, racially hypervigilant. Just a couple, as a couple of examples of racial trauma shows up as symptoms as well,
Hmm.
and the rethinking of what I should have said, what I should have
Oh
done.
my God,
I
takes
I just
so
shared with I
time.
just shared with Gliceria, and I had never told my husband about this that happened to me. Um, Years ago, my younger brother had passed away, but before he passed away, he was in the hospital, and he had been on dialysis for a number of years. And I had gone to see him. I was by myself, um, and he was tired. He didn't want to do it anymore. And he ripped. They were giving him dialysis in his hospital room, and he ripped everything out, and the blood was shooting up like a geyser. And he was telling me, "Get out, get out." And I understand it all now. But so they made me leave. But when I got on the elevator to leave, um, a doctor and a nurse, a white doctor and a white nurse, got on the elevator. And the white doctor literally took a part of my hair like that and said, "What is this?" to me. And I feel like I'm gonna cry.
Oh, me
But
too. We
but
should just sit
and
here
they
and
and
cry
they
for a
started
second.
and they started laughing. They started laughing. And they were only on the elevator like for one or two floors and they got off. And I
How did you
think
not punch him, right?
you know
Well,
what?
you
And I
can't though.
realized,
You can't.
She
that in
froze.
that moment I froze
Yeah.
Of course.
because I just had a traumatic moment in that hospital room with my brother, with my younger brother.
Hmm.
And then to get on the elevator and the fact that he did
Mm.
that. And all these years later, once I told Gliceria about it because something else happened that made me think about it and remember it. And then when I told my husband about it, I couldn't stop thinking about what I should have done, what I
Yeah.
should have said.
Yeah. Yeah.
Why did I let him get away with that?
Yeah.
And I
Yeah.
had to work through. Yeah, but you went from one traumatic situation in that hospital room with my brother, to that, and then it became what gave him the right? What made him think he had a right to
Yeah.
just touch my hair and go, "What is that? What is this?" like that to me.
Yeah.
But yeah, and that happens a lot. I think with people when we go through these racial microaggressions or racist things, it's like, oh, it plays in your head
Mm-hmm.
over and over because it's like, oh, what I should have said. Did I respond? All of
Yeah.
those things,
But
yeah.
yeah, and it's funny because when you were talking about that, Deborah, I was thinking about when we were pulled over by the police.
Oh,
We were driving from a phenomenal therapy conference, and we were talking about it in the car, and we were getting
yeah,
towards the exit, Deborah's exit to her house, and Deborah was driving, and as she was talking, she was moving her hand, and she had her sunglasses in her
right.
hand. And so she's talking, and she says, there's a police officer, a state trooper behind us. And I said, oh, okay. She's like, I think he's following us. And I was like, really? He's probably just going to get off. No, he got off,
And
right
pulled us
behind us
over.
and pulled us over as soon as we pulled, into the exit. And he pulled us over. And I could see him on the side. Now, this is the summer where a lot of people had been killed, right? And so a
Yes,
lot of Black
yes,
men and children had been killed, right? And so,
yeah.
I'm looking at the rear, at the side mirror, and he's got his hand on his
On
gun.
his gun.
And my heart started racing. And all I could remember was, put your hand on the dashboard. And that's what
Yeah.
I did. And I said, Deborah, put your hand on the dashboard. But Deborah was like, wait, why are we getting pulled over? And she didn't do that. And so here he comes. And I'm like, Deborah, Deborah, like I was really nervous because I was
Oh,
seeing one thing
you
on
didn't
one
say it
side.
that calmly. You didn't
No,
say it
I
that
was
calmly,
screaming.
Gliceria.
Yeah.
You was, Devin, put your hands on the
Yeah,
dashboard.
and
Dashboard.
she's like, but I don't have any. What were
I
you
don't
doing
have
anything?
what?
What are we doing? And then,
Yeah.
of course I was so nervous I couldn't, do the window. Deborah did the window, and then he was like, license, registration, insurance, right? And we're like, but what happened?
What did I do?
License, registration, and insurance. And I can't tell you, my heart was
Well, he
pounding
accused me of, he said that I
once he
was
came
on
back.
my phone. And I
Right,
said, no, my
right,
phone is in the back seat with my purse. It's my sunglasses.
right.
But what was so scary about that is how quickly
Mm-hmm.
it could have escalated, how
Absolutely.
quickly he thought my phone was something else. And he did. He kept his hand on his gun the
But he
entire
but he
time.
didn't tell us anything until he went and
He didn't
checked
tell
her
us anything
car.
until he checked my
And then
car.
he
Yeah.
followed us to,
After.
like, afterwards he followed us to, where we were supposed to turn.
Yeah. He got off the highway
It
and
was it was so
followed us.
unbelievable. And we
Yeah.
just kept saying, seconds, just seconds, and things, what can happen.
What
So
can
it's
happen?
like we,
Yeah.
we kind of see our journey as, we have a journey, and our journey has brought us to this place where we are, where we need to talk about these things. We need to write about these things. And, we're
Yeah.
going to,
Yes.
we're in the process of doing that, because there's just so much, stuff that is out there, and trying to integrate, all of the information, so that we could be helpful to our clients, but be helpful to our colleagues,
Yes.
so that we can do that in the period of time that we have left in this world, and so that to me is like, so there's so many moving pieces, there's so many things that happen to us. And even, on the train, the last train stop from
Oh,
Boston, and we had this man who,
upgrade.
yeah, we
We were
upgraded
upgraded to
to
first class.
first class.
And
And he kept checking our tickets. He kept checking the tickets, and we were like, what's going on? He's not checking anybody else's ticket, in first class. But nobody else in first class looked like us. And he was an African
and
American
he
male,
was an actor, right?
a man in his like 70s, 80s, whatever.
So
And so when we got off, he said, look, I'm really sorry. I just had to make sure, checking your ticket. And we're like, no, that's okay. We know that you were doing your job. He's like, I don't know what you girls do, he said, girls, I don't know what you girls do. But I want to just tell you that I'm proud of you. I'm proud of you for sitting up there, because, it's not often that people like us sit up here.
up here.
And I just want to thank you for what you do. And we just, every time we tell that story, we get emotional,
It gets
because
to us. Yeah.
it was
Yeah.
like we were seeing and we heard him and we thanked him,
Yes.
for
Yes.
that, because it was such
Yes.
a difficult journey back and forth to Boston.
And
It
not,
was,
I
and,
was just going to say,
for,
Gloria, not just him, but there was
oh,
another
the
African
other
American
conductor.
conductor
Yeah.
that we watched
Yeah.
the, and I knew what the disrespect, and he would talk to us on the train, and so I think that's what made it even more poignant when this man got off the train. This elderly conductor got off the train to make sure he said something to us, because he probably knew, we knew, you're checking us over and over and over again. And he wasn't checking because he thought we didn't belong there. He was checking because
To
he
make
knew
other people.
all of those white men that were in that particular car were watching him. And that's why he did it. But yeah, that was,
I just thought it was
yeah,
it was so powerful,
yeah,
because of everything that we had gone through. And then at
sure.
the very end, to have somebody just recognize it, it made
Nice
such a
us.
difference. And
Yeah,
it reminded me of the women of color group, where they said that we made such a difference.
difference to them. And realizing how, I think you had said it to me best, Gliceria, about how we held them. Talk about connected and attachment.
Hmm. Yeah.
I think we did that for them
What they didn't
because
have before,
what they
the
didn't
lost
have
attachment.
before,
Yeah.
and the
We
loss
were
of
able
being
to provide.
connected and valued,
Hmm.
feeling that they were valued. Yeah.
And we kept
Uh,
saying to them recently, we wish we knew about, like I wish I knew about sensory motor psychotherapy back then. I wish we knew about, this
yeah.
and that or whatever, so that we could have
Yeah.
implemented that in the group and
So
gotten.
much more.
And they're
Yeah.
like, no, you guys gave us
Yeah.
everything.
Absolutely. And we're talking specifically racial trauma, and the last three examples that you all just gave. First of all, thank you so much for sharing. Just, you know, so painful. And this is, we have to feel this. This is the truth. But every single one that you just said by itself is enough. It's too much. And this is just, you're just there's there and there and there, there's so many that you're not saying. And there's so many,
Yeah.
so wow. And thank you for sharing these things. And they're terrible. And one of the things I'm especially thinking is that, like, that whole questioning yourself part, just, it makes me so angry, but I totally get it. It's like, did that happen?
Yes.
What did that even did he mean? You know what I mean? That
Yes.
it's the invisible nature of it, which is
Yes.
part of your work, and that you're wanting to get this message out. And we're going to do our very best to push this. And but you mentioned, Gliceria, the writing and some groups. So can y'all speak to that a little bit about folks that are interested and want more?
Sure.
What's next for you?
Well, like we definitely want to write a group. I mean, we want to write about this group of women that we worked with. So we're in the process of doing that. But then, we'd like to, begin a group for therapists of color, which we mentioned, to just kind of like a consultation group for therapists. And then, a therapist of color and, white ally, like we were talking about before.
Go ahead and say it again, though, in case somebody didn't hear that first episode.
Oh, okay. We were saying about, having a group of mixed therapists,
Great.
and the white ally consultation group, the BIPOC and white ally consultation group, where the white allies should be open to reflect, to share, and to be challenged, because we're not,
Yeah, to feel
and to,
unsafe and to deal with
exactly.
it.
Well, you can say that, right?
I can say that.
Yeah. You
I'm
can say it. Yeah.
Right.
You're gonna feel unsafe. The thing is, you just got to deal with it.
Yeah, just trust
Yeah.
the process of
Yeah.
learning
And
and
also,
growing,
it's empathy.
and that racial identity piece. We have, there's different steps and different things for people of color, for white people. Like, those are the training things that people really, should kind of look for and do, so that they can grow in with themselves, so that they can be
Yeah.
present, just even for themselves. Because even like we've talked about, when even there's two white women in the room, race is still there, culture is still there, class is there, all of these stuff is still, all these factors are there, and they're
Yeah.
present, and it's
Yeah.
important,
And I'll just
um,
say real quick, even when my practice, I had more white clients, and it's part of my intake. I'd ask them, how do you identify racially? And white people could never answer that question. Never. I would get, I'm American. It's like, but a person of color, they could tell you. And so I would just, okay, how do you identify racially? And the discomfort to say, oh, I'm white. Okay. And then, and I'm this and I'm that. I'm Italian. I'm that. Okay. But can we just acknowledge that race is present? That you're white. Yeah. The discomfort.
White people don't know that we are a race.
Yes.
Like, right? That it's just the norm. And, yeah. So I love what y'all are saying about, no, it's in the room, even among two white people. It's a shared disassociation.
Yes.
You know,
Absolutely.
that,
Yes.
So this is so incredible. Go ahead.
So I just wanted to mention two other things. We did through Therapy Wisdom. Deborah and I did a training with Janina Fisher. If anyone is interested in that, we could send you the link with that. And also PESI UK. We also did like part of their certification, program there too. So we've done these kind of things also online. So if people are interested in that. That'll be great. The other thing too is I wanted to just also promote because we love her so much is Janina Fisher's program TIS also through Therapy Wisdom, which I think is phenomenal for people who are who know trauma, who know parts work, and she really helps you kind of put all of those things together in also with sensory motor, and it's just a nice package to be able to just kind of like utilize that. And it's really she's very grounded, and she makes it very easy to understand about holding and being present for the client, and all parts of that client is really important.
Yeah. Can I just go the training that we did for PESI UK? We did it last year, and it's happening again this year. A certificate program on complex PTSD and dissociation, et cetera, right? And the thing that was so interesting about that is that it was global. It was being offered, not just in the U.S. And what's amazing, we did a piece about race and racial trauma, and the anti-Blackness isn't just a U.S. problem. I'll put it that way.
So, and you mentioned PESI, and that's PESI.
Yes.
And that there was something coming up that you're going to do again. So when is that?
I think that's the hopefully in the you might have it in your note. What is it you call your notes, or people can see after? Yeah, the show notes. There's a link, and the training starts April 6th. I think it goes for like almost 9 months. It's a long training,
and they have all the top people.
Yeah, everybody.
Everybody.
Look at that. We're part of it too.
We're part of the everybody in that one.
We're part
We've
of
never met all of them.
That's a different kind of belonging, right? It's like that's wonderful.
Yeah.
But it's one of those, if you can't, it's recorded, so if you can't be there live, you can still watch it, take the test, get your CEUs.
And do you have to sign up by April? Like, do you sign up early? You need to sign up where it starts and then go, because this probably won't publish and before then.
No, right. I think it because it's recorded and they keep the recordings up.
Exactly.
If you join later, it's okay, because you still have to take you have to watch it, take the exam. The thing that you won't be part of is the live Q&A. There's
for
there's
all of the presenters, right?
For all of the presenters present, and then there's a live Q&A about what they presented. So if you're not online at that moment when that's taking place, then you just won't be part of that. You'll hear it, but you won't be able to ask the questions and stuff. But yeah,
that's wonderful.
And then the Therapy Wisdom that we did with Janina,
right,
with a lot around.
These are incredible resources, and we're going to have even more resources for reading, PDFs, all kinds of things on our show notes. And And you can find those at therapistsuncensored.com hold on, therapistsuncensored.com. And then there's a search function in case you're listening to this much later. And if you'll just even put race, racial trauma, anything like that in search, actually anything you're interested in, but to find these show notes, that's how you would look for those. Yeah. And would you, if somebody is listening now and they're interested in contacting you directly, is that welcome? How would somebody do that?
Mm-hmm.
Oh, sure. I can give you my email address.
Okay.
It's D as in Deborah, Chatman, Chatman, Finley, Finley, all one word, D Chatman Finley at mac.com.
And Gliceria, would you like to share something like that, or
sure?
My email
address is gperez, Perez, LCSW @gmail.com. And then Deborah and I both, if anyone is interested in the groups that we talked about, the consultation groups. Also, we didn't mention, but we were also interested in working with BIPOC men. Having a BIPOC men support group. Just to kind of like for us to be able to have that experience, kind of see what the women went through, but we're also seeing stuff that's going on with a lot of the men that we're working with. But our email address there is it's BIPOCing, BIPOCING, therapist with an S, gmail.com. So.
Incredible. You all have been so generous to share your wisdom and your perspective and your pain. I cannot thank you enough.
Thank you for inviting us.
Thank you for inviting us.
And giving us this time.
And making this so easy.
So easy. We could talk forever because Deborah and I like to talk. So.
Yeah.
Well, it's wonderful. And
and can I share something with you, Sue?
Please.
That you said to me. I think you might not have been on but you said something and it was so authentic to me. And you said to me, "Listen, if I say something or do something and that is uncomfortable, that's a racial call me out. You basically let me know. I want to know in the moment." And I was like, "Oh," and when you said it, it was so. It's like, if you could have saw the little thing over my head, it would have said, "Oh my gosh, she's for real." So, anyway.
I was on that call. And what I heard was, "Oh, she's safe." Okay, that's what I heard.
Y'all, this is probably the nicest thing anyone has ever said to me, as far as how I'm taking it, as far as the most meaningful thing. That is so incredible. It's funny that you say it because I almost, when we ended before and when I ended now, I almost again invited how did we do? Because if we're saying this happens everywhere, right? Like it's almost like can we find it here or this example of like something that did go well, and so I'm glad that you brought that back up because it is up to us to say to really invite it because it has been so shut down and not believed. So I'm inspired by both of you around the invitation of like, we don't know, we're in the process. I have a white body. It's a very different experience. And so that's, even sitting and sharing with me, really, really, really meaningful.
Good.
Thank you.
So, good. Well, so I think this is a good launching pad for everybody around inspiring folks to keep doing the work, their own identity work, and then to expand. And we, at Therapists Uncensored, are committed to this. We're committed to continuing to expand the idea of attachment and human development and what it looks like, and including culture and class and context and race and gender and all the things. Okay, so thank you for listening. If you're still listening, it means that you hopefully found some value. We encourage you to help us get the word out about these perspectives and share this episode with anybody that you think could be benefited, including your class. Let's say you're in a university class, right? Yeah, we want to get the word out. And then also, if we do bring value, it helps us a lot to rate and review the show. It helps other people find it. And wherever you get your podcasts, there's usually a little place where you can send us a little note we're always interested in hearing from you. Okay. Thank you again.
Thank
and
you.
we'll see you around the bend.